am Bhaskar. I retired as a professor in civil engineering from Vishal V College of Engineering. And on one day, like on 19th October, okay, I just came from the college, but before coming from the college itself, I just had some pain, little pain in my left hand, but I just ignored it. I came in a cab to my house, and after coming over there, I refreshed myself and sat down there, and suddenly sweating has started. There was a lot of sweating, and all my clothes were wet, and I could not sit, I could not stand. So immediately myself with my family, we rushed to a nearby doctor, and he suggested us to go to a cardiologist immediately. Then nearby our house, and one of the best hospitals I know is the Kamineni Hospitals. So we just came back directly over here, and directly we went to the emergency, and we made a phone call also. So everything was ready. By the time we arrived, they received us, and immediately they performed the test, ECG, 2D echo, and that was about around 8 or 8:30. We came to the hospital. The same night, they completed an angiogram also. Angiogram and stent was also put. Dr. Sagar took up this, and then afterwards, because I was unconscious, and then the next day I was told that what happened actually is that one wall was totally blocked, the other one having 95% of blockages. So I was asked to stay back in the hospital itself because it is high risk to go outside. So under their direction, I was there in the hospital, and thanks to all the doctors over here, it was Dr. Vishal who has persuaded us what to be done and how the operation ought to be conducted. Everything they explained, and even assistants, they came to us, they explained the procedures in detail, and then the operation was took up, and probably God's grace and the doctor's help that I have survived today. That's what I think so. And all these days I never expected. All of a sudden I got some disease. I came to the hospital and I stayed back over here over 21 days because whatever stent was put, it ought to be healed up, and then the next operation ought to be carried out. And in the because I was under ventilator anesthesia, and all my relatives, they told me that how difficult the operation was. They saw me on the bed, having connected with ventilators, PP machine, and they have been continuously monitoring me each and every moment. Not only the doctors, the nursing staff, they're also very much helpful to us.
నాకు కామినేని హాస్పిటల్ మంచిగా అనిపిస్తుందండి. ఎందుకంటే మా హస్బెండ్ తీసుకొచ్చినప్పుడు చాలా భయంగా ఉండే. డాక్టర్స్ చాలా మోటివేట్ ఇచ్చి మంచిగా చెప్తుంటే అన్ని విషయాలు చెప్తూ ఉన్నారు. ఎప్పటికప్పుడు చూసుకుంటూ మాకు అబ్జర్వేషన్ చేసుకుంటూ మాకు ఇన్ఫర్మేషన్ చెప్తున్నారు. అందుకొరకు ధైర్యంగా ఉన్నాం. డాక్టర్ విశాల్ డాక్టర్ గారైనా ఇంకా అసిస్టెంట్ డాక్టర్లు గారైనా మాకు ఎప్పుడు అడుగుతున్నప్పుడల్లా అన్నీ ఎక్స్ప్లెయిన్ చేసుకుంటూ మంచిగా చెప్తూ వచ్చిందండి. నాకు అందరి స్టాఫ్ వాళ్ళు కూడా మంచిగా అనిపిస్తుంది. ఒక మా పేషెంటే అని కాదు, అందరి పేషెంట్ల గురించి కూడా చాలా కేర్ఫుల్గా చూసుకుంటున్నారని నాకు డాక్టర్స్ అంత నమ్మకం ఉందండి ప్రతి ఒక్క డాక్టర్ మీద. కామినేని హాస్పిటల్లో ఉన్న డాక్టర్స్ చాలా కష్టపడుతున్నారు. అందరు స్టాఫ్ కూడా అంత నర్సింగ్ స్టాఫ్ అయినా ఏ స్టాఫ్ అయినా కూడా చాలా మంచిగా అనిపించింది.
Good afternoon everyone. I am Dr. Vishal Khante from Kamineni Hospital Cardiac Surgery Department. This is a special case of Mr. Bhaskar. He came around 20 days ago with acute MI where we immediately did his angiography and diagnosis. In his angiography we found that his right coronary is completely blocked, 100% acute occlusion. Left sided both the vessels has blocked. So we planned to do angioplasty. We did angioplasty at that night to relieve him from that heart attack. We put a stent. Dr. Sagar was very active in putting a stent in right coronary artery. But seeing his other vessels, and he survived that night. Seeing his other vessels, we decided that he should undergo another procedure for his left-sided vessel as well as his right-sided last vessel, which is called posterior descending artery, PDA, was also blocked. So he was very critical at that stage. We observed him for another 10 days. We stabilized him. Then with high risk, at that point his heart was very weak. It was only 25% of the ejection fraction, which is, that means 25% of the heart was functioning. Normally it is more than 60%. So seeing all the situations, his recent stenting, his recent MI, still with risk we took him for bypass operation. After bypass operation also he underwent bypass operation with 4 grafts. After bypass operation also his heart was not very good, so he was on ventilator and IBP, intra-aortic balloon pump, which is a machine which supports heart if it is failing for some time, 5-6 days. With intensive care with IBP, he survived for next 4 days on ventilator. We could wean off him from IBP and ventilator, and today you see him sitting and speaking to us after 21 days of continuous care. I feel this is a very special case where immediate attention on the day of MI was given, myocardial infarction or heart attack was given. Second thing, he was taken care after that stenting also, so that he can undergo bypass operation, and was kept in hospital. After operation also, as his heart was weak and was expected, his heart gave us trouble during recovery, but he recovered well with God's grace and team members' efforts. Today he is sitting and speaking. I think this is a miracle in its own way, that patient with complete care and God's help can be survived. Here in Kamineni we have all the instruments and expertise for any cardiac case, including cardiology and cardiac surgery. Thank you.